Namaskar. Welcome to Vision of Asia Voice of the Community. This is our special weekly edition of Vision of Asia. And today we have lined up for you a special sharing of memories of Rishi Kapoor by attorney Michael Phulwani. We'll also have part of the conversation dedicated to another important actor from Hindi film industry as well as international films, Irfan Khan, state representative Angelika on coronavirus pandemic and reopening from Georgia. We'll have Dr. Dixi Patel on coronavirus updates and frontline experiences from New York City. We'll have part of the Boston virtual gala to support and promote Akshay Patra. And we will have Attorney General Gurbir Grewal on COVID-19 matters. We'll also have a special segment of This Week with Padma Dr. Sudhir Parikh in today's Vision of Asia. All this coming up right after these short messages. Stay with us. Actor Rishi Kapoor is known indeed from the day he stole hearts of cinegoers with his film Bobby. Prior to that, he acted in film Mera Naam Joker, but in the long inning of his film stint, he also made a lot of friends. Attorney Michael Phulwani also became good friend of Kapoor family as they visited New York many times for various shoots. Here is Michael Phulwani sharing his memories of his personal interaction with Rishi Kapoor.
Actually, मैंने उनसे पूछा था, बताता हूँ कैसे मिले, कैसे अपन हो गए, कैसे फ्रेंडशिप से अपन भाई बन गए, बताता हूँ बाद में. पर बेसिकली जब आप आपस में फ्री हो गए तो मैंने कहा भाई आपका वो सॉन्ग जो है ना कि तो कमरे में बंद हो और चाबी खो जाए, वो बड़ा हंसने लगा, बड़ा why don't you also try? मुझे भाई हमारी उम्र निकल गई, वो आपकी उम्र थी, you were 17, 16 years old, 17, 18 years old at that time. I think that was his first movie, if I remember.
Yeah, absolutely. So
it became very fast. After that movie, his name went like anything.
Absolutely.
Before he wanted our assistance, the rule was that any time the production companies wanted to come to USA for shooting, they would just go immediately to the American consul and apply and get the visa. That rule changed, and a lot of these producers did not know until when they went to the consulate is no more like that. You have to file a petition in America with the immigration service. After they approve, then only we can give the visas for you. So then once they came to know what to do, so all the three brothers, Rishi, Randir, and Rajiv, I think, three of them, one day came there. I think they were recommended to me by Kanu Chauhan, I think I remember. And they were very close, his office and my office. So he called me and he said that somebody very important wants to meet you. I said, well, what important? Oh my, okay, send them. So they came and saw, and it was really fantastic to see. In person, Rishi Kapoor, Randir Kapoor, three brothers. And they came and made Arams Mr. Phulwani, thank you very much. Aapki help chahiye. I'm always there. So we said, no problem at all. And then we got all the information, documents, passport copies, all the information. And that was our first case on shooting also. We had done a lot of shows and all that before. I mean, at least 3-4 years before, 5 years or more before, we have been doing this Bollywood work, but not shootings. So when the shooting started, so then we took care of all that. We got visas for the whole group and then came here. Now, once he came to US, he called me. He said, "Kya kar rahe ho bhai aaj?" मैंने कहा कुछ नहीं कहा. अरे आ जाओ ना शाम को, इवनिंग में. तो होटल है वहां पर जो नेम गए हम शाम को, तीनों बैठे. उसका वहां होटल में बारटेंडर था, उसका नाम भी माइकल था. माइकल, ये भी माइकल है हमारा, bring a double scotch. So I started. No, I thought it was only one time only. Thank you. Every day जैसे क्या कर रहे हो, अरे आ जाओ ना, क्या कर रहे हो ऑफिस में, वापस कम हो गया 5 बजे के बाद ना, तो आ जाओ क्या करें, कैसे नहीं बोलूं. तो रोज घर एक दिन बैठे थे, आपस में बैठे थे, बहुत बातें करते थे. We used to work about other movies, other things and other family and all that. तो मेरे को अचानक बोला उन्होंने कि आज के बाद you are not our friend only, you are our brother. तो मैंने कहा brother, I'm saying we are three brothers. We'll add one more to our family. I'll tell my mother. He said, I'll tell my mother also that now you have 4 sons now. Kamal ho gaya. So basically, since then, Rishi Kapoor was my brother rather than a friend. I would say that. But we always treated each other like brothers. So going forward that, we did the shooting was done, the movie was done, and it was not very big one, but it is still worked a nice movie. And I would say, Abalot Chare. That was the first movie. And then that, but if you've not seen or somebody has not seen who are watching this thing, please watch it. It's very, very nice, and you will like that also. And the name Abalot Chale, I was looking in this different, also way. That this come the Bhagwan ne bheja hai, to Bhagwan ne bola ab aa jao, wapis. So I didn't say that at that time, basically, but I thought in my own mind. So we did all that. Then we became very friendly. And the daughter hai Radhima ki marriage thi. So he called me, Michael, aapki niece ki shaadi hai, aa jao. So maine kaha, bhai, I'll try. Try ka matlab kya hai? Ticket bhejun main, paise bhejun? I kaha, maaf karo, mere paas hai. I'm coming, don't worry. Then I went there. Believe me, Ashok, it was entire Bollywood, every producer, every director, Salman Khan, Shah Rukh Khan, everybody was there. For 3 days, मैं तो थक भी जाता हूँ ना करते करते दिन भर और शाम को तो ड्रिंक पीते ही थे बहुत अच्छा ही है अपना, right? So we spent 3 days very enjoyed, and I met almost every producer, director. I mean, most of them were already my clients at that time when I'm talking about.
State Representative Angelika talked to us about coronavirus pandemic and reopening from Georgia. Here's a part of that sharing.
One of the biggest questions that's concerning, many parts of the nation, reopening of Georgia, to the fact that there are salons, there are movie theaters getting opened, there are malls getting opened. I wanted to get your comment on Georgia's reopening and the impact you've seen on the number of cases of COVID-19.
Yes, Georgia's reopening, which is still a slow reopening, but it still sends to me a very concerning message, because we are not there yet. Our governor was one of the few states that was very hesitant in going into a shelter-in-place, and then we were some of the first states that actually started to lift the restrictions again. And what we are seeing now is that many people understand it as like, okay, we're going back to normal, we can go outside again. But on the other hand, the messages we're getting, especially from the experts, the CDC, is that we are really not where we should be to really going back to normal. We still have rising cases, and just today the governor was in Albany, and where we see Albany is one of the hardest hit areas in terms of cases, and then the other area, which is it's a new area that's coming out is actually East Georgia here, not far from us in Gainesville, where we see a severely increase in the cases of COVID-19, especially among minority populations like African Americans and Latinos.
Right. My question to you with that regards would be, if there is a surge in cases, which we keep on hearing on a national scale, that there's going to be a surge in cases, the number of deaths have doubled within the last 24 hours. Is Georgia as a state ready for, increase of number of cases and deaths? Right now, I feel like Georgia is doing fairly okay, but what's your comment on that?
Well, what we did in Georgia, we increased the hospital bed capacity, the ICU capacity, the ventilators, and things like this. So we increased capacity. But in terms of what we're seeing on the ground, I'm personally very concerned. And I think the recent comments from the CDC that say itself, Georgia is kind of like moving too fast, too soon. So my fear is that if we continue on that path, that we actually risk a second surge. Right now we are at flattening the curve. We really have not even met the White House recommendations of a 2 weeks decline in cases. We haven't seen this. We barely have flattened the curve. So going out so early with the message, so we have to reopen. Yes, we understand there is economic pressure and we need to address this. But my fear is with a second surge that we actually could counter the good progress we have made so far.
Have you had a conversation with the governor? Governor Brian Kemp also, had a communication with the White House. President Trump has kind of disagreed with Georgia's reopening status. What is your take on all of that?
Well, I didn't have any direct conversations with the governor, but we're meeting regularly with the governor's teams and getting updates on the progress. And they are working hard to provide, for example, personal protective equipment and increasing the capacity. But as long as we don't have adequate testing and adequate tracing, right, especially from my personal experience with COVID-19, I would be very, very cautious. And I have to say, I'm glad to see, for example, in my area, in my district, people overall heed the message and say we stay cautious, but it goes a little bit along party line, and it goes a little bit along like urban versus rural areas. So the areas that may not have seen so many cases personally feel safer. So for them, the message is, oh, we're opening, so let's just go back to normal. But the problem is that they have, especially in rural Georgia, we see less hospital capacity. It's much harder for people. I mean, Georgia already is a state where we had healthcare deficiencies before this crisis started, and they really are now with this crisis are being amplified. So if you live in an area where you don't have direct access to a hospital, or seeing a doctor is way more difficult in these areas, I fear that people will stretch out this crisis even longer without really knowing it, because they don't see as many individual cases as we do here.
As a politician, and also looking at it from a medical point of view, especially with the fact that you had COVID-19 and you are fully recovered, with your journey, what are some of the greatest challenges right now? You are in a state that is reopening. Testing is questionable right now. Treatments are questionable. We're not sure about vaccines. I would love for you to sort of, reflect on that as well.
Well, from my personal experience, we had a very interesting experience because my husband got infected around mid-March, and he was really, really very, very ill for 3 weeks. Fortunately, he's a very healthy person. He didn't need to be hospitalized. And I got sick about a week later, and I only had it for a few days. So in our own household, I could see there are different categories of how the disease plays out individually. So we simply put, we asked our doctor, we at this point just really don't know enough about this disease. We need to do way more research to understand who gets infected, why. Of course, we categorize the broad categories like the elderly, the medical fragile and vulnerable. That is true, but we also see about 25% of fairly healthy people getting severely ill and at the risk of death from this virus. So I think we need to give time to get way more research and understand how this disease affects individually, based on maybe race, based on genetics. It could be anything, but at this point, we just don't know enough.
Medical health workers have faced several challenges as they were exposed to a coronavirus, or they are being exposed to patients affected by coronavirus, and there are several measures adopted for their protection. Dr. Dixi Patel talked about updates on coronavirus and frontline experiences.
In New York, concrete jungle where dreams are made of, there's nothing you can't do. Now you're in New York. These streets will make you feel brand new. The lights will inspire you. Tear it for New York, New York, New York. One hand in the air for the big city. Street lights, big dreams, all looking pretty.
Give us some guidelines, some tips for our audience to practice within the next couple of weeks, either for their wellness or just, to make sure they're staying safe and healthy.
Yeah, so definitely, I can't emphasize enough, stay at home,
maintain the social distancing. I know it's getting really hard. You know, we've been at this for 2 months now. Everybody's probably going crazy being at home and being contained. I know us as humans, you know, we have really short attention spans and can't do that very well. But I think, you know, I think this is a moment for everyone to kind of step back and really just, you know, take the time to do the things that you never had the time to do. You know, like everyone's had this chance to now slow down and, you know, look in, you know, and kind of see, you know, hey, this was a passion of mine. Let me try to do this, you know, or let me make some time for this, or, hey, I'm here with my family now. Let me spend more time with my family, you know? So I think there's a lot of great things that being at home and being in quarantine definitely has brought for people. And I think they should definitely take advantage of this, because it's not always that you get that opportunity. So obviously for me, you know, I like to sing on the side. So that's what I've been doing to, you know, kind of, when I'm not working, when I'm at home and quarantining at home, I've been going to my music. That's been my outlet. So, and that's been keeping me sane, and that's been keeping me happy. So I think it's important to just find the things that make you happy, you know, try to stick to those things. If you want to go out for fresh air, go out for fresh air, but go by yourself. Go somewhere where there's not too many people. You know, I'm still seeing a bunch of people at the parks. I saw a picture yesterday from West Village, and there was massive amount of people there, which was appalling. But you know, like I said, just be smart about it. If you're gonna go out, go somewhere where it's just you, or, you know, like at least more than 6 feet, I would say, just because I'm, you know, hypochondriac. But just keep your distance, wear a mask when you're outside. And you know, I know obviously this can take a toll on your mental health. And I know there's people that are, you know, dealing with mental health challenges as well. There are hotlines and things that you can call, reach out to your friends, you know, anyone that kind of helps you through this time. You're not alone. You know, if you're going crazy, just reach out to your friends, reach out to someone that you can talk to. You know, we're all in this together. And yeah, I mean, that's pretty much my message. I just hope everyone's staying safe out there, and I know we'll get through this. I think we just need a little bit more time to kind of work it out and hopefully fight this thing a little bit more. But I think we'll eventually go back to somewhat norm, hopefully in a few months.
Yeah, we often don't understand the experience of people that are on the front line and what they have to manage with and what they have to deal with on a daily basis, because we're so consumed in, you know, in our own quarantined life and our own worries. I really appreciate you for your service, you know, as a frontline hero. What's your message out to other people that are on the front line, you know, and other fellow doctors? What would you say to them?
Yeah, so I mean, you know, it's been a hard time for all of us. I think we, you know, we've all kind of been in the same boat. I think we've had the same thoughts, you know. I think the main thing is that we've all kind of become united in a way too. You know, there's so many different specialties that have come in, you know, that this isn't their normal thing. I mean, I'm pediatrics as well, so we're not used to treating adults. So, you know, we kind of had to step up. Dermatologists had to step up. Ophthalmologists had to step up, you know, and now we're all treating patients that we're not used to seeing, and we didn't fully train in those specific things. So I think in a way it's almost, it's just really nice to see that it kind of brought us together a little bit, you know. It brought a lot of us together, and I think as doctors, we never expected to be in this position. So I think to all, you know, all other frontline workers and medical workers, even those that are not frontline, I think this is a great thing. In a way, in a sense, that it's brought us together, and I think it's kind of brought out this hero in us that we didn't really even know that we had. You know, it brought out things in us that we didn't know we were capable of, and I think we're gonna look back one day and be like, wow, like, you know, this experience right here, I think this made us stronger doctors, better doctors, more equipped doctors, that when something like this ever hits again, or if anything like this ever hits again, we'll have been through it, and we'll kind of be able to, you know, attack it. And I think that's how I'm kind of looking at it, like just to be positive in a sense. Yeah. That, you know, like, yeah, we were hit with something hard and it was scary and hard, but like now we're just going to be that much more stronger for anything that kind of comes our way in the future. Starting to reopen the businesses and things like that in certain states is probably not a good idea. I know some states have already started reopening. But I think because of that, we are going to start seeing a new surge of cases. And as you can see, we already are. So I know Dr. Fauci already kind of said, you know, that we need to take our time
reopening the country, and we can't really jump the gun. And I think some states have already kind of started to jump the gun, and because of that, we are now seeing a new surge of cases, and so now they're estimating that these deaths are going to increase by, somewhere I was reading in the New York Times, I think, and it was based off of the CDC. They were saying that the new data was showing that about 200,000 new cases daily will come across the country by the end of May. So, and I think that's just a reflection of us kind of reopening again and kind of jumping the gun a little bit. So,
and the numbers just jumped within a day. Do you think it is because there are 40 states that are reopening by the end of this week? Is it projected, sort of comprising of these states that are reopening and what they're projecting as the increase of number of cases and then the deaths?
I would think so. I mean, I think just looking at individual states, I mean, I was reading up a little bit on it, and I mean, Texas is seeing a surge. Dallas, one of the articles I was reading was Dallas reopened, and they had a huge number all of a sudden, and so they had a huge number of deaths and cases as well. So I think, and I think that was a reflection of reopening. I mean, they just started reopening, and sometimes it takes a little bit of time for the data to come up. So it won't, this data that we're seeing today is probably from a couple of days back. So I do think that it is sort of a reflection of reopening things. We can't put enough emphasis on the whole social distancing thing, and I just think if that's not really being taken seriously, which in some places it hasn't been, I think this is the result of that.
The world has changed with the norms of social distancing to prevent propagation of coronavirus. So there are new methods adopted to continue to work together. Many events are organized virtually. Boston Virtual Gala to support Akshay Patra also didn't lack the glory and the height that has always been a part of this organization's big events. CEO Vandana Tilak pledged to continue to work for the needy. And this work is also promoted by people like Bill Clinton, Deepak Chopra, founder of Infosys, actor Paresh Rawal, and his wife, former Miss Universe Swaroop Sampat. Youth ambassadors also participated through their messages in this Boston Virtual Gala. Here are some highlights.
Welcome to Akshay Patra's first virtual gala, the Boston Virtual Gala. We are joined by 1,000 families in this meeting, as well as a few hundred more on Facebook Live. It is indeed heartwarming to have friends like you joining us year after year, rallying behind the good work we do, and encouraging and motivating us. Thank you for being here tonight with us. In the year 2020, as events quickly went online, one thought came to our mind. However, are we going to raise funds when in previous years, everything had been done through 25 events all across the US with the help of amazing chapters? Well, the answer came to me this morning with just one word, and that word is trust. The trust when millions of Varkaris or devotees walk hundreds of miles seeking for something that means something to them. When 1.8 million children come to school to make sure that they are able to study, and 1.8 million parents trust that we will make sure that there is a meal provided for them in school, that trust is what we wish to uphold tonight and every year as we move forward with a firm commitment to not just feed 1.8 million, but 5 million every single day.
Akshaya Patra, the unlimited bowl of abundance and sustenance, founded in 2000 in Bengaluru, India, began serving 1,500 meals to a small group of school children. The organization has grown to become the world's largest midday meal program to alleviate child classroom hunger.
क्योंकि खाने से हमें कई प्रकार के विटामिन, प्रोटीन वगैरह मिलते हैं और उससे हमें मानसिक का जो हमारा दिमाग होता है उसका विकास होता है ऊर्जा मिलती है खाने से हमें।
There is no better expenditure of money, and it's really important for these kids to stay in school and to learn. So I love this program.
Giving that comes from a place of abundance is spiritual. Children have infinite potential.
In this extraordinary effort to feed the hungry children in schools by contributing whatever you can.
Living in America, I never have to think twice about basic aspects of my life, such as food or education. If I'm hungry, I just go to the fridge. If I want to learn, I just go to school. I never have to put one over the other. I've always been aware of the poverty in India, but I never knew how critical it was until I came across Akshay Patra. Their method of providing free meals in school is intelligent and creative, and is what sets it apart from other organizations. Realizing that I can make a difference in these kids' lives even though I'm 8,000 miles away is what encouraged me to join Akshay Patra.
When I was 6, my family took me to an orphanage in India. I didn't know there were so many kids living in poverty. I knew I needed to do something about it. I told my parents that we needed to go back to the orphanage to donate a few things to them. We donated coloring books, markers, pencils, and all the basic things that I would want if I were a kid. The whole experience was unreal. It shocked me to see how many children in India didn't have enough resources to live.
My family and I visited a kitchen in Bombay. It was an incredible and eye-opening experience. We first got a tour of the kitchen and learned how the nutritious food was prepared in large quantities. But the best part for me was when my family and I went to the schools to actually serve the meals to the children and spend time with them. It was amazing to see how happy they were to be able to receive these meals and meet us.
I vividly remember walking into the facility and being amazed by the size of the kitchen. I noticed how all the food that was being produced was made by hand, and that all the people involved in the production of it were working hard as if they were cooking for their own families.
It was soon to be my 7th birthday, and like any 7-year-old, I was really excited. My mom had been volunteering for Akshay Patra for a couple months before, and she suggested that on my birthday, instead of getting presents, we should have people donate the money they would have used to buy a present to Akshay Patra. As a 7-year-old, I really didn't know what to make of this, but it taught me a valuable life lesson. To always help people in need, and always try to give back.
By helping this foundation, not only would you be able to bring countless children joy in India, but you'd also be able to experience that feeling of joy yourself.
I am very thankful that I'm able to be part of a group that helps many impoverished kids get nutritious meals every day. Throughout the 6 months that we've been together, I have learned leadership skills, how to work with a short deadline, and a new way of looking at the world. I learned that we should appreciate what we have given and if possible help others who don't have that same life.
I first got my idea for a vending machine after coming back from a trip to India, visiting one of the schools Akshay Patra supports. I convinced my dad to let me get a vending machine. Along with snacks and drinks, my vending machine also displays a banner showing people how their money is being spent to feed and educate kids all over India. I'm positively sure that there's many other kids all throughout America who can come up with their own ideas to support Akshay Patra. So please, join the Akshay Patra community to help make this profound difference. Thank you.
नमस्कार, मैं परेश रावल। अक्षय पात्र बॉस्टन चैप्टर वर्चुअल गाला में मैं आप सभी का अभिवादन करता हूँ। बॉस्टन का नाम सुनते ही मेरे मन में टनाटन होने लगता है। बॉस्टन टनाटन, क्योंकि यहाँ पे मेरा दोस्त चंदू शाह, ईशानी शाह रहते हैं। मैं यहाँ पर मिस्टर देश पांडे को मिल चुका हूँ, और मैं आप में से भी कई लोगों को मिल चुका हूँ जब मैं मेरा ड्रामा का शो लेकर आया हूँ। और मेरी नज़रों में बॉस्टन का ऑडियंस वेरी शार्प एंड इंटेलिजेंट ऑडियंस। तो ऐसे बॉस्टन से अक्षय पात्र वर्चुअल गाला को सपोर्ट करते हुए मुझे बेहद खुशी हो रही है। मुझे मेरा एक डायलॉग याद आ रहा है कि इन बच्चों को भगवान के भरोसे छोड़ने पे मजबूर मत करना, क्या पता भगवान आपके भरोसे बैठा। तो अक्षय पात्र जो काम कर रहा है उसके लिए मैं उनको वंदन करता हूँ, मुबारकबाद देता हूँ, धन्यवाद देता हूँ। यू आर डूइंग अ टेरिफिक जॉब। थैंक यू। I would like to call my wife, who is a former Miss India, film and a TV star, Swaru, who is right now busy in education, in teaching teachers and in life skill program for children. Swaru.
Hello, I would like to say something about Akshay Patra. I am a huge fan of the work they do. I work in the villages in India and I see the direct result of their work. They make the most healthy, nutritive, and very clean meals for our children. Thank you, Akshay Patra. Because education on an empty stomach, I don't think that works. So thank you, Akshay Patra, for everything you do for the children of India.
This week with Padma Shri Dr. Sudhir Parikh, Dr. Parikh talks to us about various aspects related to the process of reopening. Namaskar, I'm Ashok Vyas and I welcome you to This Week with Padma Shri Dr. Sudhir Parikh. A lot is happening in the world, in India also, and what is happening around Dr. Parikh and where are his thoughts taking him? Let's find out. Doctor, welcome to this, your own show.
Thank you. Thank you.
Yeah. So how was the week for you and what has been the exciting side of the week that just passed?
Well, there are so many things are happening. The pandemic is slowing down a little bit. The new cases and new hospital admissions in New York, New Jersey area is going down. Number of deaths are going down. And that shows that we are, all this lockdown thing is working. And we are able to have enough healthcare facility in case there is a second spot comes down the road. A lot of things happening in the India. As you know, that government of India is going to evacuate all the Indian citizens, those who are stranded outside India, all over the world. Total almost starting from tomorrow, almost 64 flights are going from all over the world to the India and bringing Indian citizens, students, worker, those who are businessmen, those who are stranded here since lockdown, they will go back. They had a chance to go back to India. And I think this is a great gesture by government of India. And we must kind of give the congratulations to our Prime Minister Modi for putting together this kind of airlift for Indian citizens.
That's very good. And also staying with New York, or rather New York State and federal government relationship, you must have heard the governor of New York is kind of not very happy with the fund allocation for the state's recovery. And he also was apprehensive of the term bailout used for state. You want to say something about the relationship with?
This is all political posturing by Republican president to a Democratic governor. So I'm not taking very seriously. At the end of the day, Congress is kind of controlled by Democrats, and the senators also, though even it controls by Republican. Eventually, it's a humanitarian work. So nobody can say no to tackle any expense which costs to control the COVID viral crisis.
And one news which I got to see in some Indian television medium regarding discovery of some sort from Italy that has antibody, and somehow they claim that this is a way out of corona virus.
Well, I mean, those kind of claims are quite a few, and those IL-6 antibodies, as well as even antiviral drug by Gilead, all those things are still not proven 100%, not tried clinically for safety of those drugs. But I think there is a lot of hopes, particularly in drugs by Gilead, and that's why FDA has approved it for emergency use for very sick COVID patient in USA.
So now, a little bit hypothetical question, but you were also a part of the conversation where we had Pramod Bhagat, who gave extensive credit to Ayurveda and alternative medicine. And so, do you see some synergy is likely to emerge with more proactive approach in terms of these two different branches of medicine?
Well, because this is a very serious disease, and when it hits someone, a person suffers quite a bit. And that time, meditation and kriya and all those Ayurvedic thing, it does help and does reduce the stress, but it does not cure anything. So if someone claims that meditation or Ayurvedic medicine cures something, is not true. As well as even allopathy medication right now, we know few medication, but except this antiviral remdesivir, nothing is kind of more promising. So I think, I mean, of course, allopathy and Ayurvedic has synergy, but that's not cure. So one should not rely on only Ayurvedic or meditation and hope that COVID virus will go away. It doesn't happen that way.
Yeah. So just to clarify, it may be effective in preventing or maybe in increasing immune system so that you can stay away from some potential disease. Up to
I'm
that
not sure about that. It does not prevent anything, but once you get it, it decreases your stress situation, and it makes you a little more calmer and more composed, and so you can handle makes you more positive. So you can handle this kind of situation better.
Yeah, I think that's a very, very important statement you have shared. It makes you calmer, and if you are positive, then medically or other problems, you are in a better position to take care of them. And that reminds me of International Day of Yoga, International Solar Alliance, and Prime Minister Narendra Modi, in his address to non-aligned movement leaders, talked about the new approach where economic reasons are not the key reasons governing the framing of policies. You want to say something about that?
Well, of course, economic reason should not be a reason for framing the economic policies, because that depends on a lot of other factors. And particularly in this COVID situation, this pandemic situation, I think health of the person is more valuable than economic wellness. So I think nobody should make their decision or policy. They do not make it their policy because they want to revive the economy for sake of reviving economy, and ignoring the facts about the pandemic and health of the and safety of the public.
So staying with this, going slightly for a small brief philosophical side of life, you said in situations like COVID, many people during this quarantine period have become more introspective. Overall priority of life, if we learn some lesson from this phase, I think what you said is applicable for all the times, because the ultimate happiness may not be restricted to economic growth.
Yes, and always when you are have nothing else to do and you are completely in quarantine, it means you are literally your meditation. You are in the meditation, and when you are meditation, always you can always have good enlightenment, and that's why you realize what's the value of the life and what is not, what are the things which is not valuable, or what are the things one should not do during their relationship with other people and other human being. But unfortunately, people forget about those things again.
Yeah, that is true.
And they go back to the square one, and that is a kind of sad part of it.
Mm. And now, as we move towards India with you, there has been a success in counter-terror efforts. A leader of Hizbul Mujahideen was killed today, but recently, last week, we lost important army officers, including a colonel and a major. Looks like intruders from Pakistan or the militants in Valley are again becoming active. You want to say something about the approach that the government have and how you see?
I think government has no nonsense, very strong approach toward the terrorism, and I think we commend the government for that, and they should stay on that course. And in any cost or any circumstances, they should defeat the terrorism and they should wipe out the terrorism. And I am fully, strongly support government of India for their anti-terrorist policies.
So there are various challenges. One, when a lot of these NRIs, those or not NRIs exactly, but those Indians who are going back to India, as you mentioned in the beginning, there has to be a lot of facilities for quarantine because when these many people are coming, you want to say something about that? Should it
Yes,
be?
because the government has decided that those who are coming in this special airlift from the different countries, they want to have at least negative COVID test. If they have negative COVID test, then they can they will be let them go to their home and request them to be in quarantine for 14 days themselves. But if they don't have negative COVID test, or they have temperature, or they have something which is kind of suspicious, then obviously government of India are going to put them or place them in the quarantine facilities organized by government of India.
So while I appreciate you joining back in this show, I want to move towards the concluding part by requesting you. There are many challenges as if we are waking up as a society, functioning society again gradually. So in India, when you look at the plight of the migrant workers, they have initiated, launched some trains, but there are multiple problems which these folks will have to face. What are your thoughts in terms of the best way to handle that, not just on the level of government, but maybe community help or individual concern who are facing it?
I think I commend government's effort to let migrant worker goes to let them go if they want to their towns and homes, because every citizen has right to go to their home and go with their loved one during the crisis, and so nothing wrong in it. And I think government is helping them to arrange the buses and trains. And only thing is probably the state government should not have charged them any money to go to their villages and towns, because they are migrant workers. The fact that they are leaving the big cities, large cities, because they don't have money, they don't have work, they don't have food to eat really, and that's why they want to go to their home. And so I think government should have done, or not government, but the state which are involved should have done a kind of free service to them. And but otherwise, this service or gesture towards migrant is very praiseworthy, and I think government is doing excellent work for that.
And your final words from today's show, including some thing that you would like to share with Indian American community members here as we move in the phase of opening up?
Well, I mean, dear friends, we all know that we are kind of going towards the reopening of the society, reopening of the economy, reopening of our workplace. So, but please remember that this is a very serious and contagious virus. Please remember that you should wear the mask when you go out in the public. Please remember always kind of stay away or keep a good social distance from the other person, and do not be part of any crowd or gathering where there's more than so many people. So that is a disaster and recipe for second wave of this corona infection. So please be careful, be safe, be healthy, and we'll see you next week. Jai Hind, Jai Bharat. God bless America. Thank you.
With that, the time to say goodbye from today's Vision of Asia, a voice of the community. I would take this opportunity to remind you to join us on Facebook also as our friends of ITV Gold's page. Do subscribe to ITV Gold's YouTube channel and keep writing to us on events at ITV Gold with your suggestions, thoughts, as well as with details of upcoming events. Take care, stay safe, stay healthy. This is Ashok Vyas signing off from today's Vision of Asia. Do join us next week in this special weekly edition on ITV Gold. Namaste.